Phase 1b study of Bemarituzumab, which is an anti-FGFR2 antibody, monoclonal antibody, was published in Journal of Clinical Oncology recently. And that is a study that was a dose escalation study and expansion cohorts for gastroesophageal cancer. And essentially, the drug was very well tolerated. There were some specific toxicities, ocular toxicities, keratitis specifically, that were resolving upon discontinuation of the therapy. And so overall, the treatment was considered well tolerated. This patient population was an heavily pre-treated population of patients. And the study accrued to various cohorts, including overexpressed by immunohistochemistry 3+ of FGFR2. And inevitably, all of those patients were FGFR2 amplified, gene amplified by FISH, which was defined as a ratio of the FGFR2 probe to the control probe CEP10 of more than 2. Many of these patients were pre-screened prior to the study by investigators that knew that this was an FGFR2 antibody study, and through various means, particularly with next generation sequencing in the tissue or the blood. There were other cohorts as well with lower expressing immunohistochemistry cohorts, and ultimately the response rate amongst FGFR2 amplified tumors, which is where all the responses were, was approximately 18-19%. And so in pre-treated patients that essentially don't have any other therapies, this was considered a good and promising result. This study has led to a prospective study that was initially designed as a phase 3 study for first-line therapy of Bemarituzumab plus FOLFOX chemotherapy. And that entailed a safety lead-in, a phase 1b of several patients treated with FOLFOX and Bemarituzumab open label. And that's been reported. And the tolerability was, as would be expected when combining this agent with chemotherapy, was very well tolerated without any unforeseen toxicities. And that then led to a randomized, placebo-controlled study as a phase 3 study. However, in the fall of 2019, the study accrued to the initially intended number for the interim analysis. And it accrued very quickly, more quicker than one would expect, where it was expected that immunohistochemistry high patients, which was the selection criterion to be eligible for the study, would be on the order of 5 to 10%, which is the incidence of FGFR2 gene amplification. However, the screen positivity rate was much higher than that, and therefore it accrued quite rapidly. So in the interim, the company, and this is public knowledge, has released a press release that they have converted the study from a phase 3 study to a phase 2 study, and will be following the currently accrued and patients still on therapy for an outcome which is anticipated hopefully in the fall of 2020 to evaluate this as a phase 2 endpoint, with which, if deemed promising, would then lead to a separate independent prospective phase 3 study if deemed appropriate. So that's the publication, and that led to this study that is ongoing now.